My name is Seth Bechis. I'm a professor of urology at UC San Diego in California. I've had a great day today visiting HugeMed, and it's been a lot of fun to meet members of the company and explore, visit the company, see the manufacturing process, learn about how the scopes are made and innovation behind the research and development team. So it's been a great experience to see all the exciting parts of the process. So I think as we do more and more ureteroscopy surgeries, particularly kidneys that may have an abnormal anatomy or stones that are located in hard to reach areas such as lower poles or a calyceal diverticulum. And so having the tools to be able to navigate a scope through those different areas is really important. Some of the important aspects of a scope include its ability to deflect, also its ability to maintain rigidity and advance forward through a ureter or into a lower pole. So I perform a lot of ureteroscopy surgeries, and so for me, surgical efficiency and good outcomes is important. So HugeMed has some advantages which I really like. It's a very small, thin diameter. If we have a case where we don't have a ureteral access sheath, we can advance up the ureter. For cases where a patient doesn't want a ureteral stent placed. For other cases where I may use a ureteral access sheath for treating a stone, so I can use a 9 or a 10 French or even a 10-12 French ureteral access sheath easily with the smaller scope. Even though the scope is small, it is able to deflect and access the lower pole easily, and it has an outer rotation feature that enables you to rotate the shaft, able to navigate, in my experience, into complex areas. The scopes have a self-locking feature where I can deflect the scope downward into a difficult to reach area, and I can relax my thumb and the scope will stay there. So over a day's worth of cases, that can be really advantageous. So I think the most important feature of a scope is durability and its ability to be used across a variety of settings. And so I think with the versatility of this scope, it really can work in many settings, whether that's a ureteral stone, whether that's a complex anatomy. I think for mal-rotated kidneys or kidneys with a calyceal diverticulum. So if I have a stone located behind a narrow infundibulum, this scope is small enough that it can often navigate through easily. If I have a patient with a ureteral stricture or a narrow ureter, this scope often can get up through that area. If I have a patient who has not had a stent, who has a narrow ureter, this scope can also often be used to get to the kidney without having to place a stent and come back for a second surgery later. I think we know that if you leave stone particles behind after treating a stone, the chances are good that that patient will have a recurrent stone episode. So it's really important that we try to maximize removal of all aspects of the stone. And so suction and aspiration technologies are really going to be important. And I think as we move towards using less ureteral stents, we're going to see a shift towards smaller sheaths and smaller scopes. And I think the importance is that we use a smaller scope, we still have the ability to remove stones. And so having a smaller scope enables a smaller sheath. And if we have a smaller suction sheath, for example, we can still be able to remove stones as we're dusting them. So I think it's an exciting time to see what aspects of suction, aspiration, and flow develop as we move forward.